What area or areas of nursing are you interested in and why?
I'm pretty open with the areas. I did really like the wound care. I liked pediatrics when I worked at, and I like women's care. I work in that field now, and I find it interesting. But I'm pretty open to any kind of patient care. All patient care, I believe, when you get in, would be in a good experience, nice educational background. I would like to even maybe do some med-surg. So at this time, I'm pretty open to what I'm willing to try in patient care.
Tell me about your clinical experiences. Which rotations did you enjoy the most and why?
I liked my women's health rotation and my med-surg rotation. The women's health I enjoyed because that's what I work in now as a practical nurse, and it was nice to see the difference in how they did health care for women compared to how we do it. It was an interesting comparison to do, and I was more comfortable with the information because I'm used to it. I enjoyed the med-surg. It was challenging. A lot of different situations coming up into that, onto the floor. You got to see some different things.
What is the biggest mistake you ever made, and how was the problem resolved?
One of the biggest things I made in clinical was I grabbed the wrong fluid bag to replace. I grabbed one with potassium in it instead of the D5W with just the normal saline. Easy, my preceptor caught it when I took it over to hang it. We just switched out bags. We didn't actually start anything. It was just a missed bag when I brought the wrong thing.
Tell me about yourself. What do you see as your strengths and why?
I'm pretty. I try to be pretty cautious and careful when I'm working. I like patient care. I do my checks, make sure I have the right patient. I try to be thorough, and I try to encourage the patient and get their trust when I'm taking care of them so they feel comfortable with me.
How about your weaknesses and why?
One of my weaknesses, I sometimes second-guess what I'm doing. Not always 100% sure that I'm doing the right thing, so I'll go and ask questions to make sure I'm doing the right thing.
How would your most recent nursing instructor describe your performance in the clinical setting?
He would probably say I showed some initiative, did my checks when I was giving out medications, would look for jobs to do, would go help other staff members if they needed it, asked questions.
Tell me about your most challenging clinical assignment and what you learned from it.
Our most challenging, I went in the one day, we had a nurse aide call off, so I was given her position, and we had a patient that went downhill pretty quick, and we had to restabilize her. That was pretty challenging. I never had that happen before.
What skills do you feel you've gained from your past work experiences that may help you in this position?
I do patient care, and I like it. I like to keep my patients updated. I like to keep the records updated, make sure everything's going where it should be, keep everything, the patients moving, keep the pace of our office and the flow of the patients. I think that's important to learn how to prioritize and to keep things moving smoothly.
Tell me a little bit about yourself. How would others describe you?
Other people would describe me as having a strong personality. I'm a hard worker. I try to get the job done. I will take care of my patients, and I'm a responsible person. If it needs done, I will do it. I don't delegate to other people unless it needs delegated. Most of the time, I will do the work myself.
What are your future career plans? Where do you expect to be in 2 or 3 years?
At this time, I want to gain some experience as a floor nurse, learn techniques and experience. I would like to continue my education to get my bachelor's of science. Not sure if I want to move on and go further than that at this time. I try to do one step at a time because it's an overwhelming sometimes. Education and working sometimes can be a little overwhelming, so I try to do levels at a time. So I set one goal at a time, and that would be my goal.
Would that also be in your 5-year plan as well?
Yes, it would. To see what I complete in my 3-year would then determine what I would want to move ahead to in the 5-year.
We do not have any openings at the present time in the areas in which you have indicated an interest. Would you be willing to accept a position in another area?
I would like to be informed of the other area where the employment would be, and based on that information decide from there. It would depend where it would be, but I would be willing to look at the options.
Tell me about a time when you had to establish priorities during one of your clinical experiences.
It would be my clinical experience taking patient care, and it would be we had one patient, we had her on an alarm bed, so if you were in the middle of maybe helping one patient and you heard her alarm, you would have to go seek to see what that patient was doing, why her alarm was going off, in order to prevent harm to her.
Tell me about a time when you went out of your way to assist a family or patient, even though you really did not have the time.
One morning I came in for work and I was running a little late, and when I went in, there was a family that was in the building. They did not know where they were going. They were lost, and I walked them to the proper area where they needed to be for their appointment. Instead of rushing off and getting to work, I actually walked them to the area so they would not get confused.
Thank you for your time.
Thank you for your time.